Hey, so for this exam, you'll need to understand some common medical imaging techniques you'll see in the medical field. You won't necessarily have to interpret them, just understand what they are. So look at some of those definitions and make sure that you could pick them out on a multiple choice test based on what they do. So in general, radiography is just the use of some type of imaging technique to produce a picture, like an X-ray. So radiography, graphy is giving us that image. And an X-ray, it's like a really fast wavelength, basically, and that passes through the body. The film they use is made up of different types of silver substances, and when those X-rays hit it, you get a really dark image. And so your hard, denser objects, those with a lot of atoms, are going to absorb the X-rays faster than sort of softer or fluid-filled tissues. And so where the X-rays hit, it's going to be white on that picture, and where the X-rays pass through, it's going to be darker. It's a two-dimensional object. Oftentimes you can use it like in mammograms, bone density. Patients may be given tracers like iodine, barium swallows, things like that, in order to provide something for the X-rays to absorb. But X-ray, your generic black and white 2D image. And so radiography, depending on the type of contrast used, you can come up with different types of images. Here you can see intravenous urogram. Here we're looking at the intestines with a barium swallow. Here's a bone density scan using some particular type of contrast. Mammogram, angiogram. I know sometimes in the heart they use saline or iodine. Another common form is the MRI, magnetic resonance imaging, obviously uses a magnet. We use liquid helium to supercool the structures, and we make this massive, as if I'm there, the MRI technicians, the MRI machine is making this massive electromagnetic field, and all of your atoms are kind of aligning with that field. Then they bombard it with radio waves, and then allow those atoms to realign to the magnetic field, and those energy particles are detected. And so it's not great for things like bone, but it can show you very particular types of images like you see on the right, like this brain image scan. So it's good for soft tissue. Obviously, any type of magnetic metal, you can't use an MRI machine, or you have to have it removed because it's going to be ripped out. But those magnetic field causes the charged particles to rotate, and that energy is picked up by the machine. So MRI, magnetic resonance, anything in the text or anything in the exam that says magnet, choose MRI. So here's the picture from the textbook. The body is exposed to high energy magnetic field, causes the protons to spin, pick up that radio wave. CT scans, or they used to be called CAT scans, computed tomography, are using X-rays, but also a computer image. And so oftentimes the X-rays will be given in an arc around the body. And on the machine, on the computer, you can press up and down on the arrow and then go up and down through these, I should say superior, inferior, caudal cephalad, through the images to try to look at the organ or look at the bone and determine what is wrong, or to determine the pathology. And so the book highlights that it's replaced some exploratory surgeries. And so CT scans, computed tomography, X-ray in an arc around the body. And then here's from the textbook. You can see here, posterior, anterior aspect, heart, aorta, vertebrae. Remember, you're looking from the inferior view up in these CT scans. So from the floor up, basically. And if you recall, this would be a transverse section or horizontal cut. A very specific type of CT scan is the CCTA, so coronary computed tomography angiography. Heart, computer picture, heart picture, basically. And so an iodine contrast medium is given, and then you want to slow the heart rate with like a beta blocker. You still use multiple X-ray beams, but you're taking a very particular image of the heart. If you zoom in here, you can see the blocked, kind of see how thin that artery is. Something's going on there. So blood can't make it through that. So the CT scan allows you to have a very detailed computer-generated image of the heart rather than just opening the chest and looking. You can use this instead. Ultrasound, this one should be easy to pick up. Ultrasound uses high frequency sound waves, ultrasound. The person that does this ultrasound is called a sonographer. Here's a sonogram of a fetus. Can you kind of see it? Maybe an eye, maybe. It's like a ghost or something. It's a little mouth. I don't know. Sometimes they're hard to see, but you get the idea. Forehead, eye, hand, ultrasound, sound waves, soft tissue. High frequency sound waves. So those of you in chemistry, you know that you're learning about protons, neutrons, electrons, things like that. You can use isotopes. So elements that have different amounts of neutrons that break down, that are radioactive, that break down and release energy to make radionuclide scans of some kind. One of the common ones is a PET scan. It uses positrons, which are positive electrons, to pick up metabolism. And so you beam these positrons into the tissue, and the electrons are going to interact with that, and you're going to pick up that energy, those gamma rays that are released by the detector. So you're going to find metabolism and show metabolic function. They're a little bit more expensive, and so they may be combined with MRIs or other types of cheaper tissue scans. But you can see here, we talked about this day one. If this is the brain, anterior, posterior, you can tell something's going on. You would expect metabolic activity. Where it's brighter, red, orange, yellow, that's higher activity. Colder, darker, no activity. Blue, lower activity. And so something has happened here on that brain. You can read through the textbook's version here of a PET scan to get more detail of that. Another type of radionuclide scanning is SPECT, single photon emission computerized tomography. So it still uses the word CT, but you're looking at photons. You're still using a radioactive substance. With PET scans, I think with PET scans, you usually use carbon 11. I just looked it up. Oxygen, fluorine 18 is a common one, but these are going to have a really short half-life. And so wherever the element, the isotope, is manufactured, you're going to have to be close to the hospital if it's not manufactured in the hospital. And so, it may not be something that your rural hospitals can commonly use unless they happen to be near somewhere manufacturing these isotopes. With the SPECT scan, you're still using a radioactive substance, but you're looking at photons as opposed to the positrons. Photons, and I think some gamma rays as opposed to the positrons. And so you're still picking up activity, but with SPECT, they're usually cheaper and carried by blood to the tissue to be imaged. The radioactive substances, you pick up the organ that absorbs this radioactive substance, you're going to pick up the radioactivity from that. And again, intense color is going to represent activity. And so read through here with SPECT, radionuclide scanning, cheaper, gamma rays picked up, wherever there's brighter color, that usually shows you activity. And then finally, we end with endoscopy. It's a scope, it's a camera on the end of a tube. They can do a colonoscopy. They can do both a colonoscopy and down your esophagus. They can put it into the uterus. They can use a camera pretty much anywhere that you would need to see things, like to remove colon polyps or something, or to see what's going on if you don't want to do an exploratory surgery. And so it's using a camera on the end of a little tube where you can see somebody's little machine in there. You can do surgeries that way. But endoscopy is inside scoping. Spend some time with these, look through the textbook, read through these on the presentation, and make sure that if you're asked a multiple choice test question about them, you can pick them out from one another. Let me know if there are any questions.